Welcome everyone. It's 12:30 and in the interest of starting on time because we know it's a busy clinic day for everyone. My name is V Nguyen. I'm so excited that we're having this CME discussion with Dr. Christine James. So I'm here officially as part of Kaiser Green Team Sustainability Lead. I also know Dr. James because we serve on the Public Health Advisory Council for Climate Actions campaign together. To show you how interconnected this climate world is, Dr. James is actually the sister-in-law of Anu George, one of our pediatricians. So that's how wonderful the world is, and actually one of our patients here at Kaiser. So, this is the public health benefits of a building electrification. And so who we have today is Christy Pfeiffer from the American Academy of Pediatrics offering us technical support. So thank you so much to the American Academy of Pediatrics. And then Ashley Calderon, who's here from UC Berkeley, is our pre-med intern, Eco-America intern on this project too. So please welcome Ashley from Berkeley, who's also a San Diego resident. So thank you, Christine, for coming. I know you're super busy being a mom as well, and doing all the great work you do. So I'll hand it over to you.
Thanks, everyone. So I'm excited to be here. I wouldn't necessarily consider myself an expert on this topic, but I am passionate about it. And so hopefully what I've learned along the way, I can share with you. And just to be upfront, I have no financial disclosures whatsoever. Next slide, please. So just in terms of our agenda today, it's pretty straightforward. I'll talk about how buildings contribute to pollution and how that pollution affects our health, and what exactly does it mean to electrify a building and how that can help us, and what we as health professionals can actually do to help with this process. Next slide, please. So why should we decarbonize buildings? So buildings are actually the largest contributor to our annual CO2 emissions. They generate about 40%. So the way to think about this is 27% actually comes from operating buildings, and then 13% comes from constructing them. And we have a huge opportunity for impact because we actually spend 90% of our time indoors, which seems kind of crazy, but that's what we found through research. And building electrification is really critical to a just and healthy energy transition. So right now, our existing buildings actually make up about 2/3 of the global building stock. So if we don't take time to electrify our existing buildings, then they'll be contributing to those CO2 emissions well into 2040. Next slide, please. So first things first, we'll talk about buildings and pollution. Next slide. So this is actually some images that came from the EPA, which really show how buildings contribute to our carbon emissions from both homes and businesses. So here they show about 10%, and you see the breakdown of that with space heating, water heating, and cooking and other functions. But just one thing that I want to keep in mind is the electricity that all of these buildings use also contribute to those emissions, because that's also including the burning of coal and natural gas and oil for that electricity and heat. And buildings actually use 76% of that electricity. Next slide, please. So we have 10 states that are responsible for a majority of our direct building emissions. I was actually a little shocked that California is number 2 and not number 1. But again, that being said, you can just see here what a major contributor our state is to this problem. Next slide, please. And so what this shows here is just how gas is responsible for a majority of those emissions. They actually account for 81 to 87% of sector emissions. The difference here in these two bars is the fact that you're looking at how methane contributes. And so it varies when we think about methane estimates. But the thought is that methane actually contributes at least 18 to 44% of building sector climate impacts. Next slide, please. So this, I think, is actually something that isn't necessarily intuitive because we're constantly thinking about outdoor air quality, but in truth, indoor air quality is often worse than our outdoor air quality. So as I said, we spend a majority of our time indoors. And the EPA has actually stated that our indoor pollutant levels could be 2 to 5 times and as much as 100 times higher indoors than outdoors. And a large part of this can stem from the fact that a lot of our homes nowadays have gas stoves that actually have much higher NO2 emissions than electric stoves. Next slide, please. And so what this slide shows are the major pollutants that we often encounter indoors. So one of the biggest ones, as I said, is nitrogen dioxide. Gas stoves are actually the #1 source. And oftentimes our indoor levels of nitrogen dioxide reach these levels that would violate the EPA's outdoor air quality standards. And then you also have methane here, which is pretty important, especially since it has 80 times the global warming potential of carbon dioxide, and it contributes to ozone formation. Another gas that we're, I think, pretty familiar with, carbon monoxide. You actually find the highest levels indoors when your gas appliances aren't properly installed or you're not getting good ventilation. And even though there aren't actually, some indoor standard qualities for carbon monoxide, 3/4 of US states require some sort of monitoring of this. Particulate matter as well, which I think a lot of us tend to be familiar with because of a lot of research and a lot of news headlines really focus on this. They come from gas stoves, but then there are a lot of other sources of particulate matter as listed here, like water heaters, clothing dryers, fireplaces. And since they're vented outside, they really contribute to that outdoor air pollution. And then formaldehyde is a distinctly indoor air pollutant from gas stoves, from space heaters and fireplaces, especially when they're not vented. You can also see that from tobacco smoke. And then last but not least, ozone, which isn't actually a direct pollutant, but it's a secondary pollutant that gets formed from methane and non-methane volatile organic compounds and nitrogen oxides. And I just want to emphasize that the formation of ground level ozone is different from stratospheric ozone. So the stratospheric ozone is what we use to protect us from UV rays, right? But then ground level ozone is actually a greenhouse gas. Next slide, please. And so what this slide shows is how nitrogen dioxide really contributes to the formation of particulate matter and ground level ozone. So, when it combines with ammonia, that's where you can get PM 2.5. And then when it combines with those volatile organic compounds, and it's kind of just, has the sunlight there, they're quote unquote baking together, that's where you get this ground level ozone. Next slide, please. And what this slide really emphasizes is how nitrogen oxides from buildings actually generate can generate just as much as the nitrogen oxide that comes from light duty passenger vehicles, and is actually much larger than what's produced from power plants, which I think is, again, not very intuitive, because when you see power plants and what they're producing, you just expect that they're going to be the major sources, but not necessarily true. Next slide, please. And so what this chart does for us is really emphasize how much we're getting exposed to when we do very basic things in our home when we're using gas stoves. So what you see here are the outdoor standards and indoor standards for nitrogen dioxide. And just, one thing to point out is the fact that Canada and the World Health Organization have indoor guidelines, but our EPA has not developed that as of yet. And when you look at those numbers in comparison to, what happens, for example, when you're baking a cake in the oven or just boiling water, you're constantly exceeding the levels that would technically be considered safe for us. Next slide, please. And then methane, which I often think of it as, the underappreciated but pretty dangerous pollutant. So your gas stoves really produce methane in two ways. So when you're using your gas stove, some of that gas is getting released as unburned methane. So it's about 0.8 to 1.3%, which doesn't seem that much, but then that is actually the equivalent to the annual CO2 emissions of 500,000 cars. And then there was a study that was actually done that found that gas stoves can also be a source of indoor methane emissions because they continue to leak methane even when they're not in use. Next slide, please. So now I'm going to talk a little bit about how this building pollution and health kind of tie together. Next slide, please. So, I mean, as many of you are aware, so asthma is the #1 chronic disease of childhood. And here in California, we experience that a lot. So more than 1 in 7 children has an asthma diagnosis. And in some counties, that's as high as 1 in 4 kids. Next slide, please. And there's really 3 main factors for, why children are really more susceptible to illnesses associated with air pollution than adults. And so you see that here. Children have higher breathing rates. They're just more physically active. Their lung surface to body weight ratios are higher, and they have smaller bodies. And also their respiratory and immune systems are more immature. Next slide, please. And so what you have here are a number of health effects. Most commonly we think of kind of the respiratory system, that increased risk of childhood asthma, irritating their airways, putting them at higher risk of respiratory infections, just their baseline respiratory symptoms that come with asthma becoming more aggravated, even their lung function changing. But even beyond that, there's been research that's linked learning deficits and cardiovascular effects, as well as an increased susceptibility to allergens, linking that with higher levels of nitrogen dioxide. One thing to also note is research has also shown that diseases like diabetes, cancer, as well as reproductive effects have also been linked to those higher levels of nitrogen dioxide. Next slide, please. And of course, there are other vulnerable populations. So people of color and low income communities, structural and institutional factors have really perpetuated the disparities that they experience related to pollution exposure and disease burden. And so a lot of this comes from things like structural racism, community disinvestment, redlining, the inequitable access they have to housing and quality housing and healthcare. So things like transportation, industry, and power plants are common polluters, but gas combustion in their residential buildings are actually among the most common sources of outdoor particulate matter pollution. And then you also have those who are pregnant. Their exposure to carbon monoxide, particulate matter, and nitrogen dioxide has actually been linked to the adverse birth outcomes that you see here. We think that may be due to the air pollution exposure passing to the baby in utero through the placenta. Then you also have the elderly, where these air pollutant exposures increase their risk of diseases like pneumonia, heart attacks, stroke, atrial fibrillation, as well as neurocognitive decline, including the increased risk of dementia, as well as an exacerbated development of Alzheimer's. And then, of course, those with pre-existing conditions like asthma or COPD, cardiovascular disease, that pollution can just worsen their symptoms. They need to use their medications more. They'll be using, the ER or other hospital services more. And there's also been research that links premature deaths. Next slide, please. And going back to, that the population of those who are lower income, there are a variety of factors that are contributing to the higher levels of nitrogen dioxide in their home. And so you see that here, having smaller unit sizes, having bigger families that are living in these small unit sizes, the fact that these homes tend to be older and don't have great ventilation. And, with that, they end up using their stove or oven to help with supplemental heat. A lot of where they live, a lot of the buildings where they live are built next to high traffic roadways, so they have more exposure to outdoor air pollution. And then at baseline, they have a greater asthma burden. Next slide, please. So one thing about, carbon monoxide, I mean, I think we're all pretty familiar with the fact that, we really encourage people to have these monitors. And so what this shows you are the different carbon monoxide levels and what the alarm thresholds are and the types of symptoms that you can experience at these different levels. Now, part of the issue though is that this is really addressing these, acute time periods, and you're having really high levels. But there has been research that has looked at how that long-term exposure, even to low levels of carbon monoxide, can have an impact on our health. Two studies actually really looked at the neurological effects, and they connected these low levels of carbon monoxide exposure to things like changes in memory, changes in sleep, sense of smell, balance, as well as anxiety. Next slide, please. So I think that this is actually a pretty surprising fact for a lot of people, the fact that buildings are the #1 source of pollution-related premature deaths. And that really comes from PM 2.5 and ozone emissions. So there's a ton of research that looks at particulate matter and ozone and how it's been linked to respiratory disease, both in the acute setting and then, of course, chronically. And but from a premature death standpoint, so a 2021 study actually showed that the PM 2.5 emissions from commercial and residential buildings were actually responsible for 18,000 premature deaths and $205 billion in health impacts in the United States. And there was actually another study that linked ground level ozone exposure to 1 million premature deaths each year. And that isn't just, all related to respiratory disease. There's also been a lot of research looking at how this air pollution exposure is linked to cardiovascular health and mortality. Next slide, please. So when you look at the health costs of gas appliances, so from a big picture standpoint, we have 5 million people in California who have asthma, and we're spending $11 billion on that each year. So if you actually replaced all the gas-fired appliances that we have in California with electric alternatives, we'd actually save $3.5 billion in healthcare costs. And then just, a couple other studies found that, in Australia, for example, this study found that 12% of their childhood asthma burden is attributable to gas stove pollution. And then another study kind of was comparing different costs and basically looking at the fact that, in the US, we spend $80 billion annually. And then the annual per person asthma costs $3,000. But the cost of an electric stove is significantly less, $500 to $1,000. So there's the huge economic impact that can come from building electrification as well. Next slide, please. So now we'll talk about, what does it mean to electrify a building? Next slide, please. So building electrification, what does that really mean? So, what we're referring to is the fact that we want to replace gas, fuel, oil, propane appliances with more efficient electric ones. It also means eliminating your leaky windows and doors, because that keeps your keeps your electricity demand low. And then also trying to use battery storage and solar panels, which can be really useful during power outages. Next slide, please. So how do you electrify a building? So, these are just a few of the different things that you can consider. So with home heating and cooling, or, building heating and cooling, heat pumps are a really great alternative, because what heat pumps do is they use electricity to transfer heat between two locations using a refrigerant. And there are a couple types of heat pumps. So you have a ground source heat pump that uses the Earth's relatively cool temperatures in the summer and warm temperatures in the winter to really regulate that indoor temperature. Then you also have an air source heat pump, which can heat a home by transferring outdoor heat indoors, and vice versa. So just the way to think about it is the fact that, just heat pumps are really energy efficient. They can provide that heating and cooling in a single appliance, and they don't release any sort of pollutants indoors or outdoors. And then in terms of water heaters, your heat pump water heaters actually work in the same way. Now, one thing that kind of comes into play is the cost, but there are subsidies that can help with that. And there's an organization, the Rocky Mountain Institute, that you can go to their website, and they can actually help you figure out, kind of cost effectiveness, and how to find, a water heater that works best for you. Clothing dryers actually, so 1/4 of clothing dryers in the US actually run off gas, and so they vent nitrogen dioxide outdoors. So there are electric clothing dryers that can help with this, but traditional models are energy guzzlers. But more recently, there's been the development of actually efficient heat pump electric dryers that actually cut that energy usage by 28%. And then, of course, last but not least, and what you're probably hearing about the most in the news, is actually using an induction stove. So there was a 2013 study that looked at children living in homes with gas stoves, and it found that they had a 42% higher risk of experiencing asthma symptoms, and a 24% higher risk of being diagnosed with asthma. So this is where induction stoves can be really helpful, and they're just a more energy efficient option. Next slide, please. So the benefits of electrification. Next slide, please. So there was actually a study that looked at 2 public housing apartment buildings, and what happened when they actually used green housing, and with switching from gas to electric stoves, they found that your nitrogen dioxide levels actually decreased by 65%. Next slide, please. And there was actually another study that was kind of trying to estimate, if we did invest in electrification, how would that change, our bronchitis and our bronchitis issues, and the cost of that. And what they found is by doing that, in reducing your ambient particulate matter exposure, you actually had 350 fewer deaths, close to 600 fewer cases of acute bronchitis, and 300 fewer cases of chronic bronchitis. And in total, this was equivalent to $3.5 billion in cost savings. Next slide, please. And what's often not realized is just how much gas appliances release nitrogen dioxide. So it's 16,000 tons a year. And you can see here this study from UCLA that looked at, when you look at the different areas in California, how much nitrogen oxide emissions they have in a year. And what they estimated was that, again, you can save over 350 lives annually and avoid almost 900 cases of respiratory illnesses each year. Next slide, please. So again, just kind of coming back and putting it all in perspective, what you get are, in these 5 areas, just a lot of improvement. So with healthier indoor air, those high risk populations like children, pregnant women, individuals with pre-existing conditions, low-income individuals and people of color, who all of these are populations who are more likely to be affected by that air pollutant exposure. Certainly that would very much improve. And then with, outdoor air, electrification would significantly reduce our particulate matter contribution. And then you would also see fewer premature deaths. In terms of efficient heating and cooling, I mean, this is particularly important for our elderly population and children because they are more sensitive to those extreme temperatures. So this actually allows, electrification allows for maintaining your indoor temperature much more efficiently. And then, of course, from a safety standpoint, one of the big focuses is carbon monoxide. And so by going towards an electrification route, you can reduce your carbon monoxide exposure risk. And then last but not least, and probably the most important, is equity. A lot of climate technology and programs have historically failed communities who are more at burden from this exposure and from the diseases that come from air pollution. So when we think about the type of work that we do in this area, we really want to make sure that these policies are equity driven. So we really want to prioritize the racial and environmental justice, access, and affordability. Next slide, please. So how can we get involved as health professionals? Next slide, please. So, first things first, really engaging in the conversation. So, trying to stay up to date with the evolving health science in this area. So you've already taken a first step by coming to this talk. But again, there's a lot that you can learn about. So the EPA and then the institute that I mentioned, the Rocky Mountain Institute, have wonderful resources to learn more about this. And then joining a state, regional, or national advocacy group. So just a few examples. V and I are a part of the Public Health Advisory Council here in San Diego, but we're always looking for other physician advocates to join us, in this fight. There's also Climate Health Now, another great, it's a California-based organization that focuses on climate change and health, but they do have a specific focus on building electrification, as well as Physicians for Social Responsibility, another great resource as well. And then just in our day-to-day, I think assessing our patients, this plays a really big role. So, asking about gas appliances, what they use, and talking to them about how that can contribute to indoor and outdoor air pollution and the connection between that pollution and their health outcomes. Recommending reduced exposure, which I'll actually talk about in the next slide, and trying to encourage electric appliances. Now, here's the thing, you can really take a 3-tiered approach to that. Shifting some of your cooking events from your gas stove to electric appliances that they own, like microwave ovens or electric ovens or toaster ovens. You can also invest in a low-cost plug-in induction stove. There are also actually a lot of incentive and rebate programs that can help your patients if they feel like they can't afford doing so. But I think oftentimes what I found for, for my patients specifically is especially when a lot of them are renters, is, writing a medical letter of necessity, excuse me, that they can take to their landlord. This has actually worked twice for me, surprisingly enough. But I think that a lot of times the landlords of these places, they don't necessarily want to lose a renter. And if there's, if you can try to talk about it in a way that would also be cost efficient for them, I think that tends to, drive them more towards, okay, how can I adjust the environment for this person, rather than trying to find someone new to occupy that space. Next slide, please. And so these were just some, recommendations that I wanted to make. So a lot of people, don't always think about these things when they're at home, but, making sure that you have a carbon monoxide detector that's functioning and is properly installed. If you are cooking with a gas stove and you have a hood, please try to run that. But if you don't have that hood, try to open a window so you can get some good ventilation, cooking on the back burners, using, as I said, using other electric appliances, and a plug-in induction stove is $50. So that can be, a possible option for people. And then if you are able to afford it, switching to an electric or induction stove. Next slide, please. So just in conclusion, again, commercial and residential buildings are a major source of pollution, and this pollution can have a big health impact. And by electrifying our buildings, that can actually play a big role in addressing pollution, and it's tied to our health. And we as medical providers have an important role on a lot of levels. And I think that's it. Next slide. Here's my contact information for anyone who has any sort of questions or comments, or if you have questions about how you can get involved, I can certainly help you with that, and then be an even better resource for that. So thank you all.
Christine, thank you so much. I mean, I've heard you speak many times, and I am just like blown away in terms of what's going into my brain right now. So it's, yeah. And I think we often talk about in the climate world, it's amazing that the solutions for the earth are oftentimes, and actually most of the times, the solution for our patients. So, and actually ultimately the cheaper option, right?
Right.
And so I'm just so honored to know you and to continue to work with you. And thank you for stopping by here for us through the AAP and Kaiser. So it's a small but mighty group. I actually love it because everyone's here from their own heart. So I think you can just unmute if you have questions. I have tons of questions, but I'll let other people go first. And I think we have pediatricians from League of Women Voters here, multiple medical groups outside of Kaiser, a lot of Kaiser. I think someone from the Sierra Club is here. So yeah, so shoot away anyone with questions. You can unmute or put in the chat box and I will read off.
All right, I'm going to ask, I'm Jeannie Brown. I'm with the League of Women Voters, but we're part of a coalition with the San Diego building electrification. And yeah, we've been trying to, I would love to use some of those slides.
Oh, of course, yeah.
Yeah, we've been sharing the health information about, especially for children, as much as we can, but we would love to have you as part of our coalition. We've got like 30 organizations as part of that coalition.
Sure, I'd love to. And yeah, certainly I can share the slides. I'm going to clean up a little bit. That's okay, because you always notice things as you're doing an official presentation. So I'll try to clean them up a little bit. But yeah, I'm more than happy to share the slides. I think one thing is, I do think that children are such a big focus, for this issue. But I think a lot of people don't realize, this affects everyone across all ages. And so, we all really need to care about this issue, certainly.
Right. And we did an Earth Day thing about this yesterday or Saturday, and we'll do another one on the 29th, next Saturday at Malcolm X Library.
Oh, wonderful.
Mhm.
Great.
Thank you.
Thank you.
Yeah, so for folks who don't know, League of Women Voters is hugely influential in San Diego as a nonpartisan group. And they actually have an environmental justice subcommittee, which there's multiple members here. And I myself have now joined League of Women Voters because they, so the mission is is the same. So you can always join the league. And then also, yeah, we'll definitely make sure to get those slides to you. That's hugely powerful. So thank you so much.
I had a question, Dr. James.
Mhm.
I think I'm convinced after watching this presentation to change my gas stove to electric. But do you know of any programs that California might be offering to recycle our gas stoves? Because I also don't want that to just wind up in a landfill.
You know what? That is a great question. And I am going to, I can try to look that up, but I have a couple contacts at Rocky Mountain Institute, that organization that I mentioned, and they are so in the know about all of that information. So I'll email them and I can, get the answer back, and you can, certainly distribute that. But let me ask them. I can't imagine that there isn't, but I would hope. But yeah, that's a great question. So let me ask, and then I'll get back in touch with you.
Thank you. Thank you for speaking.
Yeah, no problem. Actually, I need to do this presentation for my husband, because we need to replace our gas stove as well. So.
So I'll jump in since there's a little bit of a pause. We recently had Anderson Plumbing, who is actually Kaiser is their preferred provider, which is great. We had the HVAC consultant at our house. And so my question is, I had thought, it's these heat pumps so important, right? And especially with heat waves coming, we need to get, there are going to be heat waves this summer probably again. Then I had a friend who said, but it's going to drive up, air conditioning is going to drive up greenhouse gases. So whether or not to involve like the Anderson Plumbing in this, which sounds kind of crazy, right? But it's a business, it's a good business who employs their employees are very happy, tend to not leave them. So I just thought what you thought about like inviting them into this space, like, an air conditioning company,
Here's the thing is that that's kind of a complicated question, right? Because of, how all of these different, what we need for our indoor environment. But the thing is that I do think it's important to have their voices at the table, because, I for one understand kind of the basics of how things work, right? But I don't know all of the details. And so if there's a way to, bring those voices to the table, I think that, education on both sides is really helpful. Because then otherwise, sometimes I feel like we're speaking into a vacuum a little bit. Even for myself, like I had to understand, kind of what are the different ways to generate electricity, and how does combustion of fossil fuels contribute to electricity at all. And that's been my own kind of deep dive, that there are things that I still don't understand. And so I think that, again, having those people come in and try to explain that, I think can help us get to a bigger picture of how do we do this in an energy efficient way, and one that really benefits the climate and addresses our health concerns.
Okay, no, yeah, no, it's fascinating because we were just, I talk about climate all the time, and the HVAC consultant was there, and I started talking about indoor air pollution. He totally got it. He was like talking about leakage and this and this and this. So he was fascinated to kind of know more about what we were doing. So, okay, thank you so much.
I think that they know more than what we maybe give them credit for. They're just not maybe talking about it in the same way that we do, because they're trying to get something done.
And we have this great question from Dr. Mary Lou Lindegren, who is part of the American Academy of Pediatrics and also a climate person and part of the Environmental Justice Subcommittee of the League of Women Voters. Does the AAP have educational materials for parents about this? If not, can we as a chapter create these materials?
I'm going to put that to you, V.
Honestly, you're right, Mary Lou. Like, it's funny. I've been so proud of San Diego. I feel like we're out front and center, like ahead of everyone. And so this is the first kind of push. And I think we want to create educational materials. And actually, Ashley, that's a great thing about having these wonderful pre-med interns. My thought was this would be a project for Ashley because we have web space with Christy and the AAP office has given us to kind of link to this talk, but also have educational materials. So I think that's a great task. So Ashley, that's will be your project because we need it for the earth and for your applications. Hand raised by Linda Daniels. Hello, Linda.
Hello. I put in the chat that I'm with the Sierra Club. I'm also with the San Diego Building Electrification Coalition. Have you heard of them?
I have, yeah.
Okay, they have over 40 companies, not companies, but organizations from 350 San Diego to North County Climate Change. And we're working on presenting building electrification to every single city. It looks like San Diego is listening to us and they're putting it into their agenda. The mayor's really been working with us. But in the meantime, if people want to try out induction stoves, we have induction cooktops that we lend out. And all you have to do is go to ehomecooktopscom and you can get one for 3 weeks to see how you like cooking with induction cooking. We even give you an induction pan to use if you don't have any induction pans at home. Okay.
Oh, that's fantastic. That's amazing.
ehomecooktopscom. All right.
Perfect. Thank you.
So from Valerie, one of our wonderful pediatricians who are trying to pull into climate work, because she's super smart, Stanford trained here. Induction cooktop requires all new pots and pans, correct? I'm guilty. I'm about to do this. I might go do that loaner program. So I don't know.
So this, generally it's, I think the first things first is actually checking to see if your pots and pans are compatible, because you may not even realize that some of them already are. So you don't necessarily have to get a whole new set. So I would probably look at that first before just engaging in, okay, I need to buy all new pots and pans. I mean, a lot of people I think work with steel pots and pans, things like that. But again, if you don't have something that is conducive to that, then yes, you would need to invest in that. Anyone else with questions and also please feel free to, as I said, email me, any questions or comments or concerns.
So any last call for questions? We'll do a 10 countdown. 10, 8. Okay. So I have to say, I learned tons and I'm just so conversations, right? This is how we start. And so small, mighty group and so many different groups, right? Coming together for this webinar. So this is recorded. So thank you, Kirsty, for bringing that up. And so we'll share this widely through the San Diego community. And thank you everyone for coming and for Kaiser for providing the CME and Christine James for giving your time to this work. And then we'll give you back the last 15 minutes of your time. But I'm blown away. So thank you, Christine, for sharing your work with us. And I honestly we'd love to share your slides through the AAP website if we're able to, just to kind of increase the knowledge of building electrification and get this done for San Diego and hopefully for the country.
Of course. Thank you. Thank you all so much. Really appreciate it.
Anu says thank you.
She has to. All right. All right.
Thank you, Dr.
Adios.
James, Dr. Nguyen. Thank you all for attending.
Thank you guys. Have a great day.